super excited today to have Dr. Michelle Weiner on. She is by trade, interventional pain physician, but she takes a really unique approach on how to treat patients. So go ahead, tell us a little bit more about yourself.
So I'm a pain management physician, and I've been in private practice for like 15 years now. And I founded Neuro Pain Health. And the practice is really based on the fact that all pain is biopsychosocial, which means it's not just what's going on in the body, but also affects how we feel, our emotions, our thoughts, our belief systems. So the main goal is really to personalize chronic pain treatments and not just to kind of protocol, give everybody the same medication or the same injection. So I learned a lot about integrative pain management from medical cannabis, because that is a plant that I personalized to help people with chronic pain. And then I moved into ketamine-assisted psychotherapy to really try to understand the root cause of a lot of people's pain and addiction.
So I've known you for a long time. I think even fellowship days.
Yeah.
Did you come out starting that way, or did you come along?
Well, so my primary specialty is physical medicine and rehab, not anesthesia. And that is a more holistic approach to musculoskeletal medicine, traumatic brain injury, spinal cord injury, so a lot of neurodegenerative conditions. And then I did interventional pain. And so when I realized that chronic pain is really a combination of someone's mental health and what's going on in their physical body, I started to realize that everything I learned in fellowship was really treating acute pain. We were doing epidural injections, joint injections, treating people with opioids, anti-inflammatories, and that was good for the acute pain. But then I had a whole fibromyalgia clinic, and for some reason I was like, why are these patients not getting better? And why am I so attracted to trying to help them? And I just felt like that population really kind of interested me, which most pain doctors really don't like that population.
I was going to say, you said the word, in a past life I had a fibromyalgia drug. You probably don't even know that. And so that's how I got into pain management and doing some of the implantables. But most patients push those people out. There's not really anywhere for them to go.
Right.
But you came up with a curiosity of how do I help these patients?
Well, and I did it mainly based on how I felt in the room with them, in the sense of like the experience of the patient and connecting with myself and trying to think, this, I can't lie to the patient. Like, this medication is really not going to take away your pain. Or how many times are you going to get an epidural steroid injection for disc degeneration that may not actually be the source of your low back pain? And how many people have peripheral neuropathy, but yet we're not talking about nutrition and what's the actual cause of their pain? So I realized how multidimensional chronic pain is and how everything should be done in a personalized way. But most of the time, someone gets chronic pain from what happened in their past and what they're basing their present sensory experience. So someone may have a past experience of trauma or chronic stress, which kind of makes them more likely to not be able to heal. And when someone doesn't heal, when like the normal tissues don't heal when they should, then we have to look a little bit deeper and understand maybe they had an autoimmune condition, a virus that kind of created this sensitization to pain. Maybe they have depression or anxiety. Maybe the fear is fueling their pain. So it's always looking at the whole person from mind, body, and spirit to understand how we can treat them, because really I have to connect with the person to help them. I can't just look at their MRI and say, okay, this is the best treatment for you. I have to understand, what do you think is the source of your pain, or what makes you feel alive at this time? And a lot of times people in chronic pain completely lose their purpose. They're, really focused on their body and not really focused on what's meaningful to them in their life anymore.
Yeah, I feel like that, so I don't know if I've ever talked about this on the show, but I did intrathecal pain pumps for a short stint, but I did spinal cord stimulators mainly. And the people are so hyper-focused on that pain, they will do anything to get rid of it. They don't have a life, literally. The people that are going down that route that have that level of pain, they just want someone to handle the pain so they can, it's almost a reverse so they can get their life back. So we're acutely or very aggressively trying to do those things. One other thing you said is the epidurals, and the first one works always, but you saw it's like a law of diminishing returns because we're not looking at other things. And the reason I gave you, I told you, I had this conversation the other day. Someone's asking me, "Oh, but it's all about the microbiome." And I go, "Well, that's one of the things that presents itself." I had this conversation, which I don't know, you've met before, but with Dr. Miranda, I like to I like to ask serious questions with her and see how it all kind of comes together, like you were just doing with pain. And I was like, yeah, I had this conversation with someone the other day. They're very high-end venture capitalists in our world. They do health and wellness. And brilliant. And they were really focused on a couple of key indicators, one of them being the microbiome. I was like, well, of course, if I eat terribly, I have an inflammatory response, which my underlying thing I took from you is there's, a lot of these times there's an inflammatory response, there's some trauma, there's all these things coming together. And if we don't start taking care of the different pieces and figure out how to bring those together, that's where the art of medicine really comes in. And most physicians don't have the time to do that. You are trained to handle a lot of things acutely. And then now America and the world's getting upset about it. But I'm like, we've created this monstrous system. And so we were sitting down having lunch, trying to figure out, well, my perspective is, how do I get the physicians to be the lead and to help patients and do what you're doing and let them know there's people that can help in this matter, instead of, oh, the physicians stink and we're going to replace them. I think that's a very slippery slope. And there are people out there like you that can look at this in a multidimensional way and start to come up with a plan to start removing these little barriers and find a holistic way to help that person.
Right, but also, sometimes people get too hyper-focused on one thing, like it's all the microbiome, or
Correct.
It's all mitochondrial, or it's all fear, right?
Yeah.
So then they're very focused on using one treatment to treat everything, which is, it's never that. And it's always like a multidisciplinary team approach and also a multidimensional view of the person, because the mind and the body are always connected.
Mm-hmm.
And the brain is always listening to what we're saying. And yes, the gut is our second brain, and we all understand that. And nutrition is so important. And honestly, my first line of treatment is always movement.
Mm-hmm.
I always say movement is medicine, because if someone is not moving their body energetically, they're stuck in their thoughts. A lot of times, physical pain keeps someone stuck, like they're not able to exercise, they're not able to walk, then they fear they can't go on vacation, or they're not able to be with their grandkids. That also creates this hopelessness that then plays into their physical pain. So it's always a combination of things, but I think that understanding who the person is and how they got here is actually the key to treating them, because if they're not really understanding, is it a specific event that happened, or is it multiple stressors over time, or is it something that's physical in the body that acutely was fixed by Western medicine, but then a story was created around it, and now their identity has become, I have chronic pain, I can't do these things. It keeps them stuck. Sometimes they want to be stuck. Mm-hmm. And then you have to understand what are your fears? Why are you not willing to move forward? And that resistance creates a lot of distress. And so people look at pain like it's in the peripheral body, but really a lot of it is actually suffering. Like the person is literally just suffering, and that creates a hyperactive default mode, which is a network in the brain that really identifies the story or personal narrative of who we are. And now they're defined by their pain. It's very, I think what it is for me is it's more neuroscience. Like it's actually like, neuroimaging has showed us that stress creates these changes in our prefrontal cortex, and now we're not able to regulate our emotions or resolve conflict, and stress can actually create depression. And people don't understand, even inflammation can cause depression. People think it's like not enough serotonin, that happy molecule, and that's just so basic. And we know that SSRIs are really like one option, yes, but people don't have always a deficiency in serotonin. And a lot of times it's actually their nutrition, or it's some type of inflammation that's just creating this sensitization. And you see it because they become hyperactive to other things. Like they'll have chronic pain, low back pain, but then all of a sudden they have migraines, or they have IBS, or they have TMJ, and it's like this is one route, but all these different, branches, but we go to all these specialists, when really we just need to listen to the person and understand how this all started, and then give them a safe container to make them feel safe to try to heal.
So how do you start with that patient? That patient comes in, that's a lot of stuff. I know that's not done in one visit.
Well, it's not done in one visit, but I also have a team. I have a psych nurse practitioner, I have coaches, I have facilitators, I have nurses, and I like to have multiple eyes on the patient because I'm not always going to know the answer, or I may not always connect with that person. So I usually like to understand why they think they have pain. Sometimes they'll say, well, my MRI shows that I have a disc herniation at L4-5. Okay, and that is what keeps you stuck in your house, or that's what's not allowing you to go to work? What do you really think it is? And then we get a little bit deeper into their belief systems or their values. A lot of times they have these beliefs like, I'm not good enough, I'm not worthy, and that kind of plays into their physical body, and it doesn't allow them to really have quality of life because they're kind of limiting themselves. Or maybe they just had a divorce or they lost their job, and it's triggering them to go back to these beliefs that they had when they were younger. So a lot of times I'm doing more of like a psychosocial assessment of them. And then we have to talk about their nutrition, movement, sleep is so important. Are they getting restful sleep?
Oh yeah.
If they have pain, are they sleeping well? And then they wake up the next morning and then already they are making bad choices with nutrition, or they're saying, I can't do certain things because I have physical pain. So it's a very long assessment. We call it a biopsychosocial assessment. So
I'm fortunate enough to have this is actually, I did not think any of this was going to come up. Very interesting. So traditionally in the pain world, we'll do a psychology analysis to make sure they can get an implant, or just to make sure they're okay or something like that, but not to actually get to the underlying problem, more to treat from an acute position. I'm correct in remembering that, right? I still remember in here? Okay, awesome. Yeah, but there is a lot of those, psychology and psychiatrists as well will tell you like a lot of these problems come from our childhood, and there's these belief systems that we get from I think the formidable years are 7 to 12, especially around that 7 to 10 age, and you get these belief systems and they kind of hold you back, and that's part of like growth of a system, but they can definitely bring you down too. They can actually completely drive you down. So I never heard someone in the pain world bringing this. I think it's super fascinating to bring in a psych portion of that to help kind of start moving that. I love that you said movement is medicine. That is coined by her. I'm not stealing it. I absolutely love it. Moving, we're meant to move, in one way or another, whatever that looks like, and whatever you have, maybe some things that you have to deal with or pain, but if you can move, that's what we're meant to do. And if you can't move, I guess back 1,000 years ago, you'd die. So sorry for being so blunt, but I'm not. But that's one thing we talk about. And, one of these hot topics that is out there is like, longevity. And it's like, yeah, but the number one longevity thing, the number one thing you can do is like move. Right. Move in some way, try to add some strength training. And the second part's like a social aspect. Right. So if you don't have both of these things, right, because you have all this pain, you're not moving, and then I keep to myself because I have this pain, that's all I can think about. You already have these two main things that are very human to us, and you're kind of like bringing them in. And this is how I think about it, but I'll leave it to the pro.
Physical pain, and therefore you stop moving, and then you're thinking, movement doesn't have to be going to the gym. It doesn't have to be running. Like we talk about posture, alignment, mobility, all of those type of things. That it doesn't mean like you need a gym membership, or you need to go buy a bunch of equipment. We just say get a yoga mat, put YouTube on, do some exercises. Some stretching is huge for people, and a lot of times it's just getting them out of their head and dropping into their body. And I feel like so many people are anxious these days or stressed, and I ask patients, how are you feeling? And they're like, and I'm like, you don't feel in your head, you're thinking in your head, but you have to really drop down. What am I feeling in my heart, in my body? A lot of times the people that I'm seeing have had trauma where they don't really feel safe in their body. And so now they're interpreting these signals as danger. And so I think a lot of what we've learned over time in the past like 10 years, since you've probably not been in pain management, is that
Still miss you guys. Some of you, not all of you.
Is that sometimes pain is actually just the brain's signal to pay attention to something and slow down. And it tells you there's some type of threat or danger, slow down, pay attention, and you have to look into that signal. But sometimes people are raised with trauma or abuse or neglect where they're really not feeling safe in their body, and therefore they're hypervigilant and everything becomes danger. And that's when people really have chronic pain, because their nervous system is so sensitive to any type of impulse and they're interpreting things inaccurately.
So, that's such an interesting way to look at that. We ignore signals all the time. Our bodies are so magnificent, perfect. I feel like there's an underlying spiritual thing that we're talking about here. I just feel like there's something there besides just the psychology, and I've, midlife crisis, going through my little journey now. But I can totally see that. So I want to...
Well, there is a spiritual component.
There is, yeah. I don't know if you want to talk about it, but I want to hear it if you were willing to talk about it, because I was just talking to Rob about this right before here. I've always been into it, but I've never figured out what it is I like. And lately I've been a little more dialed in. So go ahead.
Yeah, well, I think mind and body is important. And I think that Western medicine can deal with the brain and the physiology and the genetics and metabolism and all that kind of stuff. And then there's this bridge between Western and Eastern medicine when it comes to chronic pain. But a lot of our traditional therapies are not working. Opioids are not a great idea for pain. All these injections over time, steroids are not a good idea for many different reasons.
Yep.
So we have things that are good for acute pain, but then chronic pain, you have to think sometimes there's a deeper source to it. What's the actual root of someone's addiction, let's say, which is really in their pain or in some type of trauma or stress. So when it comes to the spiritual component, you have to be careful who you're talking to, and they have to be open to this. But sometimes when someone can actually see themselves from a different perspective, like using cannabis or ketamine, where you're actually creating a different perspective on what's happening, it allows them to reprocess things in a different way. So initially, I started using medical cannabis to help people get off opioids, and that was very, very effective. It helped their pain. It helped to kind of distance them from overanalyzing what's going on. It helped them sleep. It helped their depression. And it also allowed me to understand personalized medicine. Like someone may take an edible and have a response that's completely different from somebody else, or how sensitive they are to THC. Some people get anxious, other people feel calm. So I think personalized medicine is very important. When it comes to the spiritual component, it's what that person thinks is actually the source of what's keeping them stuck. Mm-hmm. So a lot of times when we give someone ketamine, which is a dissociative, it's not a classic psychedelic, it gives them the opportunity to quiet the story of what's going on in their mind, to then be able to see themselves from a different light. And I think that is really what's very helpful, because a lot of times people are feeling stuck in their thoughts, in their story, and they can't really see a way out. And now you give them a medicine, it calms their body, it kind of opens their heart, it quiets their mind a little bit, and then all of a sudden they're able to say, oh, I'm actually free, or I actually can start to trust myself again, or I lost myself a while ago, and now I really want to try to reconnect with who I am. Mm-hmm. And the goal is to get them to connect with their source, their self, whatever you want to call that, mm-hmm. which is its own entity, and I think a lot of times we have to tap into that. Like, how did I get into this industry? It's by me really listening to myself, saying, prescribing meds and doing injections is not going to help you 10 years later. You have chronic pain. Like, we need to take a different approach to how I'm treating you. So how can I connect you to who you are? Because you have to be your own healer. I'm not here to do more work than you. And a lot of times the healing comes from them really starting to connect with themselves, saying, I made this decision in my life and it kind of put me onto a different track, and this is not really who I am, and I don't really have any passion or joy, and therefore I wake up not understanding what is meaningful in my life. And so a lot of times we're just trying to figure out what makes someone feel alive now. And most of the patients I have very low motivation. They're focused on their pain or their depression or their stress. And we're trying to really get them to understand that they too, whatever age they are, whatever their imaging and MRIs show or their labs show, we're not really treating them, we're treating the person. And they have the capacity to heal themselves. We're always going to have pain, but we have to be able to adapt to what's going on. And sometimes they just need a shift. And a lot of times it's actually not just like the spiritual, like, oh my God, I saw myself all of a sudden as this big, strong person, and I haven't felt that way in a long time. And yes, visualization can help, but it's also what we're doing with neuroplasticity, which is really changing the way that the nervous system is learning. And a lot of times our habits are what is the foundation for why we develop chronic pain and depression. People who don't sleep enough, they don't socialize, they don't move, they don't eat well. So foundation-wise, we're always talking about lifestyle habits, but then we're also having these experiences where people are able to realize they can be their own healer, or they can trust the process when they're really control freaks and they're not able to just kind of let things go. But when you let go for a little bit, your nervous system can really reset itself. And when it does, it gives you an opportunity to change the way you're living your life.
I have so many things to say, and I'm probably going to forget half of them. I'm going to try to go backwards. That was absolutely fantastic. One thing I always think about is reframing, right? So if you're focused all the time on your pain, that's what your life is going to be about. What you focus on is what you become, like, right? And I know Tony Robbins has some quote around that, but like, you reframe your life. Okay, yeah, my pain stinks, but you know what? Today I'm going to go for a walk. I'm going to have a good day. And actually, I saw a clip from, funny enough, Tony Robbins yesterday. It's like 10 minutes in the morning. He changes being responsive and reactive to being gracious and having gratitude. I'm so happy, he said, like, it could be simple. I'm so happy to have my son. I'm so happy to wake up today. I'm so happy to see a blue sky or a gray sky. It doesn't matter, right? And just starting that neuroplasticity and changing and reframing your day instead of constantly feeding the narrative of negativity. Right. So when you're constantly feeding yourself that this is who I am, this is what I am, there's no room for growth. It's very rigid, and anything that attacks that narrative creates a stress response. I don't know if I should be talking about this. I'm not a doctor. And so I think, and that's where we get all this stress, plus the fact that we have these phones, we don't go outside and like disconnect at all. So it's constantly this and constantly living at this level of stress, which creates inflammation, which can cascade from your perspective, like from a pain side, all the way to internal medicine, to any segment of medicine. It can absolutely create a terrible cascade of problems. And when you're constantly operating at that, because we used to be out in the wild hunting, and then when something would hunt us, we'd freak out. But we're always operating at stress for nothing that should be stressing us out. But that's what we've created. We created that kind of narrative. And the thing that keeps us there is our egos fighting constantly. This is who I am, and we can't change. And so when you start to like remove those layers slowly, and you can refine your purpose and who you are and connect to whether it's a spirituality or who you want to be, those are the things that can start changing and making these lifestyle changes and helping with your pain, helping with your health. You know, there's a lot of people that can't continue on the medical side, can't get pregnant because they're super stressed out. I've seen this with a dear friend of ours, you know, and they got the money for IVF one day and then they got pregnant naturally. Like, you know, like, and I've said that story many times. They got pregnant a few times and, you know, they were about to drop the 30 grand back then and wonderful. And I've seen this happen a few times. And it's just, we're creating this stress all the time. And I knew I was going to forget some of the other things. So what you said was so fantastic, but I don't.
But also what you brought up was the ego. And I feel like sometimes when we talk about classic psychedelics, they talk about ego dissolution, right?
Yeah.
Because if we were to dissolve our ego, which is really like a phrase, you know, but the ego is kind of what keeps you stuck. It's sort of there to protect you, make good decisions, but at the same time, if the ego is running the show all the time and you're disconnected to yourself, then you really are not really following your passion or your purpose, because you're in more of a defense mode.
Correct.
But the ego is there for a reason. However, when you give someone ketamine or psychedelics, it quiets the ego. And that's so beneficial when people are really trying to control everything and they're constantly planning. And then, you know, I have patients who come to me and they're in such a place where they're shopping around, you know, what should I do next? Because Western medicine has failed them, but really their personality, their characteristics of like who they are, type A, and always Googling and looking for the answer, that's the source of probably why they have chronic pain, because they're not able to just kind of let go and feel into their body and understand this is a good solution for me. They're not even listening. It's just a matter of how many patients have you had with this condition, and what's the highest dose of this medicine you could give me? And I'm like, what kind of work are you going to do?
Right.
A lot of times it's actually letting them understand that they're the ones who have to start making changes in their life, as opposed to coming just, we got used to giving people medicine and telling people that they're going to get better from a medicine, and now
Quick fixes.
Right, it's like how people think they have a chemical imbalance. That phrase I hear all the time, and it's like, depression is not a serotonin deficiency. We totally understand that there's so many other causes of depression, but they're just wanting a quick fix, or they're wanting the medicine, or it's, let me just finish until I can retire, and then I'll take care of myself. I hear that all the time. And then they're so disconnected from themselves, their patterns and habits have really created who they've become, but now they're just kind of stuck in this role, and it doesn't really serve them anymore. So a lot of times, seeing from a different perspective is a good opportunity for them, but they also need social support, consistency, accountability. Initially we're like, go outside, be in nature, listen to some music. We're trying to change some part of their daily routine to allow them to connect in a different way and see if they have a different emotion behind it. So I'm really big on behavioral activation. I'm not a psychiatrist or a therapist, so most of the time people have already gone through that process before they've seen me. Now I'm trying to change their behavior and see, will their thoughts or feelings change once they're actively socializing or out in nature or starting to do some type of stretching or mobility, breath work. It's hard to get people to meditate, right? They can't really quiet their mind, and they don't really think that that's going to be helpful for them. But then we give them other options, just mindfulness techniques or breath work, anything to get them to feel in their body, because I just think the whole world is just so neck up, like consumed in their thoughts, and then when they realize their thoughts are actually what's causing their disease. It's so simple, but it's so difficult for them to stop the loop or to stop ruminating, and they kind of get stuck in this negativity.
You're dropping too much information for me to process. It's so good. Okay, so thank you. I'm going to say 3 things so you can call me out. You did remind me of one of the things I want to talk about, which was the disassociation with ketamine. The second thing was, what is the patient putting into it? And then, you just said one other that was really good. So I'll just do that so I don't have a bunch of hiccups on the camera. So that's one of the things I forgot to go over, and I think that is really interesting. There's a lot of different values and ways to go about that. So you can kind of disconnect from that ego and have that thing. And one thing I want to say on that is, I'll wait till I retire, and I have 2 things to say that. Number 1 is, you can take some space and still be A-type, okay? Now, that took me a long time to figure out, by the way. I just started learning this.
That's a great point.
You can have some space and be clearer and not go through this wheel and still be A-type, and actually you'll probably make better decisions. And if I had to take a guess, good-natured and relatively good-souled, really good businessmen do both. Now there's some people that utilize that recurring thing and that need to come from a place to prove people that do very well, but they're causing a lot of disease states. So you're causing your own disease states, and then you wait till you're older, when I'm done with this, or when I sell this company. What is the cost of that loss of health, right? And the conversation I had last week, someone did very well, sold their company for multiples of, not 10, but multiples of that, 8 figures, crushed life, brain tumor.
Wow.
Got through that, and now and this is the person I was talking about earlier, all they do is venture capital in our world. Wellness, how can I help people become healthy? How can I help more people understand that? And understand you can, do both a little bit. They've come into a spiritual world, and they also play in the world of the alternative medicine. Let's put it that way. And you can say whatever you want. I don't know if YouTube and Meta give 2 shits, but I don't. So don't worry about it. Sometimes they do squash us and don't allow us to say that. So I think there's something really important there. But I do want to talk about a little bit, and if we have time, we'll reverse into the business side of things. Tell me a little bit more. I know ketamine is really important. You did go over a little bit, but tell me a little bit more about how you got there, and what you utilize ketamine for. I did text you randomly about this one day about a North Carolina license. We'll talk about that off camera.
But I do want to talk about creating space.
Okay.
I mean, I think that's a really incredible point that you're making, because when I describe what dissociation feels like, I basically say it's a space that the person can create, and it's like a timeout from the world. And imagine if you just created this timeout where you get to actually connect with yourself. Your mind is quiet. You're not the story of who you are. You're not all these beliefs or the negativity, and you just really get to create this space. What do you want to do in that space?
You're doing like, when you do that, when you don't create this space, you're working on like an automatic programming.
Right.
You're not the creator of your story.
Yeah.
You're doing a default story. I didn't want to forget this part, but go ahead.
No, that's what it is. That we're trying to get people to feel powerful enough to create their own story. And I always say we're the caregivers of each other's nervous systems. Like,
I love that.
I say that with my team. I say it with my kids, my family, because really the way that our nervous system feels, and that's why when I'm with patients, I don't really say you have depression, PTSD, chronic pain. You're a person, and what is your experience right now? And that's what we want to get people to understand, is that everything can change. All pain can change. Your mood can change. How you regulate your emotions, what you put your attention on, all that can change. In the space, though, sometimes you just need to quiet your default a little bit to have other parts of the brain connect and communicate to get you a different perspective on what's actually happening to you. People are so entrenched in their habits, and really this is a neurological thing. Like the way that the brain is, people have hyperactive amygdala from past trauma, where they're really focused on their anxiety, everything is fear-based. That just doesn't go away. But when you create this space, it gives you an opportunity to reset. And I tell people it's just a break from your pain. If you were to just come here for an hour, I give you some ketamine, you're just gonna not have pain for a little while, which makes you understand, first of all, it's possible to not have pain. Second of all, in that space, were you able to calm your nervous system in a different way? Because most of the time, it's just nervous system regulation. Like, what are the techniques you're doing to stay mindful, to stay in your body, to not catastrophize and think that this pain is now the worst pain ever and you're never going to heal and it's only going to get worse. So a lot of times we're creating that space, and creating that space is so important because we talk about set and setting, which is the mindset going in. What's their intention? Their intention is to release the anger they have or the frustration they have, or they're willing to feel joy or to connect with themselves in a different way. So the mindset's important, the space is really important. Our office is set up in a way to make people feel very comfortable and relaxed. It's decorated in a way so that they feel like it could be like their living room, or like the recliners, they're listening to music, they have eye shades on. Eye shades are important so you're not allowing other external stimuli in your brain. Your eyes are closed, you're listening to music, the music has no words, it's very calm, relaxing. Sometimes it takes people to like India and Japan on their journeys because of the way that the music is working. And the music, we say, is like the hidden therapist, because really they're in there listening to the music, it's guiding them, it's helping them calm their nervous system, but it's allowing them to get out of their head so then they can start to connect in their body. So ketamine, because it's a dissociative anesthetic, it takes away pain, but it also allows you to have this dissociative experience where you're kind of like, it's like an out-of-body experience where you're sort of not feeling your physical body as much, but you're really able to go a little bit deeper into your conscious mind and quiet that and allow other things to come up from your subconscious. And so there's this like gray zone between conscious and subconscious, and that is a really important filter. And so ketamine and psychedelics can really quiet that and give you answers. Like sometimes the patients just hear things and I say to them, nobody whispered that in your ear. All of a sudden you hear trust, believe, or like these mantras that I am loving awareness, and they have these sayings that come to them. I had a patient who had a lot of cosmetic issues, and she heard, I'm perfect the way I am. And these are things that are really in her subconscious that maybe she wasn't able to really connect with, and now she hears these things that gives her this embodied experience of, oh, okay, I'm perfect the way I am. And it shifts people really quickly when they realize that they're healing themselves, and it's not just the medicine, but the medicine is just like a tool. It's like a catalyst to kind of open them up, create this change in their nervous system. The thing with ketamine, it's usually done a few sessions in a row so that we're creating that change and steering it in the right direction. And that's important, is that we need coaches to have them be accountable to, but also to give them guidance.
That makes sense. I would just, when you were saying there, I took two things from there. I mean, just different clients, or different patients, I should say. Like, if I'm in pain all the time and all I'm thinking about, and then I get a dose of this and I'm able not to have pain, I can see, feel, and then think consciously and subconsciously, oh, I don't have to have pain. I didn't have pain for an hour. Well, that's what it feels like. And you start to rewire your neurons, right? And you start to, oh, that is possible. What else would it be? How could my life be? And I could see the positive effect. And then those kind of things, when you were just talking about, it gives you an opportunity to take that break, that space that we were talking about for a bit. I never thought about that way. That's really fascinating. That's amazing. You give these patients, but you give patients that little buffer that they can get out of the monkey mind, that constant, like we talked about, the ego, the narrative that they feed themselves, or I'm not this, I'm not this. And also the way we use words and how we speak to ourselves. And I talked to my little ones about this. I had this, I'm not good at math. No, you're having a hard time right now at math, and you're gonna learn how to do it. If you keep saying I'm not good at math, you won't be good at math. It's like how we speak to ourselves. It's so it can be so negative, and it can feed.
It's just reframing.
It's reframing.
Exactly what you just said.
Yeah. Or your teacher's not that good at teaching you math. Not saying who that is. Probably don't give her an F.
I have anxiety, right?
Yeah.
Or I am anxious. It's just different ways of saying it. I'm this type of person. Now that people really put themselves in these boxes. Patients like to sometimes kind of store things away, and that comes up in different ways. Sometimes people repress a trauma, an emotion, or they just try to, move forward without really addressing it, and later on it comes up and they think, is that from this? It's not from that. And really it's like, maybe you gotta look a little deeper. So, I think with ketamine, it has to be done with a lot of care. And I think that's really very important in terms of personalization, because people hear a lot about ketamine, they get nervous, they get overwhelmed. It's a dose-dependent medication. I can give you a little dose of ketamine and you can feel like you're meditating, or you can have a much higher dose and feel like you're in the stars, flying in the sky, completely separated from your body.
Ooh, off-camera talk.
It could be done IV, intramuscular. We like intramuscular. IV is more of a consistent feel. Intramuscular, we're usually dosing them 2 injections over time. But it's personalized in terms of what type of person they are, how anxious they are, have they ever done psychedelics before, how severe is their pain, let's say, or we do intranasal, which is called Spravato, which is a form of ketamine that's covered by insurance, and it's FDA approved for major depressive disorder and treatment-resistant depression.
So 2 things from that. Number 1 is, you just said something that we hit upon earlier, is one size doesn't fit all. You need tailored medicine. You need to find someone that can tailor to your needs, that can help you in all aspects, whether it be pain, primary care. You should have a team of people that are tailoring it to you. The problem that we have online, and the problem is most of the voices that are the loudest are the ones saying that if you do this or take this pill, you'll be good, your microbiome will be perfect. No, you need to have someone that can look at all of your factors, who you are, because you are really unique as an individual. Because from a psychology standpoint, nobody has that, because you went through things yourself. And number 2, you're pretty unique in your body. There's 90-something% that's more or less the same, but there's quite a few percentage points in genes that make you completely unique. So someone has to kind of look at it that way. Number 2 is, and just digging a little bit more on the spirituality, is we used to be outside wearing a woolly mammoth coat, running away from saber-toothed tigers. Okay, and so we had to look at things and be like, is it this or is it this? So when you say, I am depressed, you are quickly categorizing and self-judging and really using this very old lizard brain that loves to take control of us. And so when you start categorizing yourself and saying, this is who I am, your brain will start to believe it. And so that's why I realized that too. It's like, why am I this person if my whole point is to grow as a person? And so like I can create who I want to become. And so when you start becoming the creator of your life, I promise you things will get better. It's hard, I'm not gonna lie, but you can start to see things for what they are. And you talked about the kids, and we'll have more stories about that later, but because we're running short on time, but you will continuously push whatever happened to you and your trauma to the next generation. And I realize this sometimes, like some of the things I automatically respond to are the same things my dad did. And I'm like, wait a second, I don't want to do that. I said I was never going to do that. And until you start to take that little bit of space and see that, you'll keep passing it on. You'll still keep that. And I call that generational wealth or not, right? So you can be wealthy in a different way, not just financially, by not passing some of these bad habits that we have automatically.
And that's really important, is that so much of what we learn is from our past experiences. So now we're taking our past experiences and our sensory present and creating our life, which is also affecting our mood. And then that dictates a lot of what we're going to put our attention on. So past experiences, everything is learned, how we're raised in our household, how we're raising our kids. There's so many defaults, and then we get to question them. Oh, I don't even like that, but I do it. But then now it increases your awareness to say, next time, I'm going to do it differently.
Mm-hmm.
And then even if you don't do it differently, you still become more aware that you want to change it. And it's just like this small, consistent push towards where you want to go in your life. But it's really actually self-awareness. And a lot of times, people realize they're their worst enemy. It's really that negativity that's bringing them down, or they're in this sympathetic fight or flight for too long.
All the time, constantly.
And their brain is never shutting off. And that really, honestly, I believe that chronic stress is the main source of why people develop chronic pain or depression these days. And that's more of a neurological thing that we totally understand. Loss of synaptic connections, dendrites that are not growing properly, that are not communicating properly, and that will totally affect our neuroplasticity. So now we've learned something, now we have to be aware of it, and then unlearn it, and then figure out how we want to do it instead, which has, you can't do that on your own a lot of times. So that's where this whole team approach comes in, and I feel that people are, like you said, are able to still be that type A productive person, but they have to prioritize rest. And I just recently realized that.
Yeah, me too. I'm like, wait a second, because you talk about the pain side, but I have constant inflammation from being stressed out all the time, and there's not really anything attacking me, or I'm taking it as an attack because that's how I'm responding to it. I'm constantly at stress. Now, if I have all those cortisols flying through my body, which I have done, I'm off the charts. I haven't done it again. I need to. I'm going to do it soon because I'm starting to create some space. I'm hoping to see, I will see positive because it was off the charts. There's not much higher it could go. But if my body is constantly under that duress, under that stress, like my body can't fight now. So I'm opening up to all sorts of disease states, right? And no matter how much I take care of myself, at some point in time, something has to give, something has to break. So we have to kind of find a way.
We call it the body budget. So
there are so many coins in this. Oh my goodness. I hope you write all these down.
Lisa Feldman Barrett. She talks about the body budget, right? And she talks about the brain being bankrupt. So imagine if you had a bankrupt brain, what does that look like? That's like sleep deprived, poor nutrition, lack of movement, no social connection, and also no spiritual connection. I think all of those components are really important, but the body budget, it's like check in with yourself and feel that will dictate your mood, and a lot of our choices are just kind of based on how we're regulating our emotions and what we perceive, how our brain predicts what's going to happen. And what our brain predicts is going to happen is based on, in the past, what has happened and what was the outcome and how did I respond to that. And I feel like a lot of people become very reactive to things, and they're not really able to just kind of sense in their body, take a moment, and then respond.
Yep.
So the body budget is important to check in, just to feel how your mood is, but also to understand in the past, how have you done this before? What's the awareness? What do you want to change going forward? But then it's actually creating a plan, and that becomes very difficult for people because they're like, I don't know what I like to do. I don't know what my hobbies are, and then we're just doing simple things like maybe you can't exercise, but let's start to garden, and then we'll be outside in nature, and then you'll, get a little sun, you'll move your body, you'll start to connect in a different way with yourself and quiet your mind, and just simple activities, like even people say, like, I clean my house, Okay, fine, that's still a form of movement, right? It's not exactly exercise, but it's something to get them to do something different. And I think that's the most important thing, is really, we're trying to create change. So you can't keep doing it the same way and think you're gonna get better. You can't just take more medication and think it's gonna go away. Sometimes you really have to, pick the rug up and really get it out.
Yeah, and I think any form of movement that you can utilize where you just take some time away from your phone. My two favorite, me personally, are snowboarding and water polo. I can't do either one on my phone. I'll fall or drown. I have to be completely present, right. So like anything you can do where you can put something away and be present, whether it be cleaning or any other items we just mentioned, whatever works for you, you'll have a little bit of space. You'll give your brain some time to relax and heal and think freely. I know there's some other topics did we cover all the topics you want to cover? Because we are she has to go to the office, so, and go help all these patients. What other topics, anything else you want to bring up before we kind of start winding down?
I think people should just, understand that it's time for them to allow themselves to heal, and they do have the capacity to heal. And I think that we're so focused on medications and these studies, like who are funding these studies, and are these studies even rigorous? Like, what, in order to do an epidural steroid injection, the studies are what? You get more than 30% people get relief. That's like placebo. So,
yeah, I was going to bring up placebo earlier.
Like what we've been using for a long time, it's not exactly working. Like, we have more depression and chronic pain and such a huge health burden. So obviously we have to take a different approach. But now we can choose to give the person the opportunity to participate in their healing, as opposed to just trying to give them more medicine or like a different type of medicine in their injection, right? Which, of course, yes, there's many other options, but ultimately they're the ones who are going to have to do the work. And then the work is, what does that look like that's personalized for everybody? And yes, a lot of it's based on lifestyle habits, but then there's also this wake-up call to say, you're still living. You don't have to wait until something happens to then take care of yourself. We need to consistently take care of ourselves. And I do think rest is important. Cannabis is an option for a lot of people, just to kind of decrease some of their pharmaceuticals, but also give them a little bit of deeper connection with themselves. And I feel like a lot of times I was using cannabis for chronic pain or for sleep or depression patients. I use it for patients with Parkinson's, cancer, all that. And then sometimes they'll take a dose and they'll actually start to connect with themselves in a different way that allows them a different perspective on their life, which is really healing. I use ketamine at people's end of life, which is really interesting for palliative care, so that they're actually having this spiritual connection, that they feel less scared to pass away. Oh, because there's almost this like feeling like they're in heaven already. Because once you're taking a classic psychedelic or ketamine, you're in this different state of consciousness, and it allows you to kind of put your guard down. And so end of life is a great place for it. I do think ketamine can help with a lot of things, but it's a placeholder until the classic psychedelics are FDA approved. And unfortunately, MDMA did not pass for PTSD, and that was a big problem. And there's many reasons why it didn't, but ultimately, the classic psychedelics would be like magic mushrooms, psilocybin, LSD. Those all activate a serotonin receptor, which is very different than ketamine, which really works on the NMDA glutamate receptor. And classic psychedelics will definitely create big change in mental health. They're just Schedule I drugs right now. Some states, decriminalize them, but there has to be therapy around these medicines, and then also, studies talking about safety and long-term effects of them.
The good thing is there's some of these studies going on. I before we talked off camera, I know that Johns Hopkins is looking into a lot of these as well. I know you rotated through the VA. And there's a lot of people that have a lot of issues that can't be solved. And I think this is a wonderful opportunity to look at some of these things that have been kind of shoved aside that could really help people. And they're seeing, I mean, this one may have not passed, but they are seeing some good results. You want to talk about any of that stuff? I mean, feel free.
Yeah, sure. So MDMA is a form of an amphetamine, but it also increases oxytocin, which is that love bonding type of hormone in the body.
You know what else is an amphetamine? Our ADD drugs, right?
Our ADD drugs.
So stop looking at this so bad, dude. All your Adderall's an amphetamine, okay? It's not a big deal.
We're taking them every single day.
Right.
The studies with MDMA for PTSD, they're 3 dosing days of medicine with a lot of therapy and coaching associated with it. And MDMA is different than the classic psychedelics like psilocybin. They all activate the 5-HT2A receptor, which is a psychedelic receptor, and the experiences are all very meaningful. We're not trying to get people to a place where they're not able to remember. The insight from these sessions are important, which is why even when I give ketamine, I don't give Versed or benzos or anything, because it kind of shuts down the journey and it shuts down the lesson. And a lot of times, people think for pain management, huge doses of ketamine, and just have them sleep through their session, and it's like you're missing their ability to see themselves from a different perspective, to allow them to heal in a different way.
Allowing them to naturally have that space to go through, right. We'll call it the journey, but their experience, if you don't want to use that word, whatever you want to call it, whatever you want to call it.
And psilocybin will probably be, or an analog. So what they're doing is they're taking psilocybin, for example, and they're just trying to decrease the duration of the drug, or they're trying to create an analog that's similar to it, but not from psilocybin mushrooms, obviously. So there's all these studies going on for OCD, PTSD, generalized anxiety, a lot of neurodegenerative, like even dementia, Alzheimer's, they're studying that. Many different conditions where we really can't figure out what's the source of it. And yes, maybe there's an anti-inflammatory component, maybe it's that glutamate GABA balance in the brain, all these different potential mechanisms. And then there's the other side that's maybe there's all of a sudden this change in their mindset that then allows them to create a different perspective. So I think that it's very exciting to think that psilocybin and MDMA and all these psychedelics could potentially be available. However, it has to be done in the right container, and that's so important. People just microdosing mushrooms or taking mushrooms out in nature, maybe they're going to have a difficult trip that's going to be very overwhelming to their nervous system because they're not in a safe place, they're not with someone that they feel safe with or who can properly care for them. So, I will just caution people that these medicines have great, profound, transformational abilities. However, it has to be done in the right space with preparation and preparing their mindset, but also integrating these sessions. So now you have the session and all of a sudden you feel like you can make this change in your life. What does that look like? Otherwise, you just took drugs. You didn't even really integrate the lesson. So it's really the whole process that has to be done. And I think that people think, oh, it's just, it's just mushrooms, so it's safe and it's from the ground, it's not like that. These experiences could be 4 to 6 hours where you're very anxious in your mind, or you're not really, sometimes it does the opposite when you don't properly prepare.
I find that so fascinating that people can go and just go anywhere, and sometimes it's in the States, out of the States. You guys aren't allowed to do so many things, but you should be the one integrated with these compounds and these pharmaceuticals. And allow the smart people that went to school for a very long time to become a part of this, to help people. And then they, the FDA, and bless their hearts, and I know they try to do their best, and it is what it is. At the end of the day, it's politics, but I said it. And it's very rigid. So that rigidity may not get you what you want outside, because people are going on these journeys in the middle of a forest doing these same compounds and coming out with a good experience because they got lucky and got a good coach, but then you could get a bad one and things go really sideways. But if we had people that were well trained, that understood how to bring all this together and orchestrate it, we probably have much better outcomes. And that even comes back to, now let's get outside of that. If you have a really good team and you're given placebo, you have good outcomes. So why wouldn't we take the educated people that understand how to bring this together? That was interesting. How to bring this together and let them be at the forefront. And I think that's another problem that we have in medicine. And so we're gonna find a way to give the power back to the doctors.
Well,
So.
and to allow the person to heal themselves.
Yeah.
Because yes, power back to the doctors, but then again, some doctors are not really passionate about what they're doing, unfortunately. And you know, the integration of these sessions, like the medicine is great and it gives you this experience, but then what you do with the experience is what will determine if you're going to have lifelong change or not.
And it's the same thing with primary care. How much skin are you putting in the game? Everybody wants a quick fix, but no, let's start with this. And I was going to ask you this question too, but let's start with maybe a quick acute treatment to get you stabilized, and then let's talk about how we can start changing those lifestyle habits and the way you eat and the way you don't move or whatever it is to become a better person, a more integrated person, and work with your physician. I think our expectation now, and we've also created this with insurance often, is you come in, get a pill, go, I'm good. And my mom's a great case. My mom has high cholesterol. And her friend's like, well, you can eat cheese now. She's like, that's not the point. I'm gonna eat cheese here and there because I love it, but the point is I shouldn't be eating cheese and I have to be on this medication, so why would I do that to myself? And we think so poorly. And I've talked about this before. We're like it's not healthcare, it's sick care. And we need to kind of change that around. But yeah, you have to put skin in the game to feel better, get better, but giving that power back to you as a physician and then me as a committed patient, there's no stopping that. There's just absolutely no stopping that. So change your mindset and the way you look at medicine. Come in, find someone that's going to work with you as a team member. We kind of look at that like we're the quarterback of your health here, but we are your team to keep you healthy and take care of you and introduce you to other physicians that can help, like you. And that's how it needs. You need a team of people to keep you healthy in the long run and optimize you. Yeah.
It's not like you came to me and now I made you better and now you're done. It's a lifelong process of really understanding who you are and understanding where you want to go and then becoming that person, which a lot of times is reevaluating what has happened in the past and what your values are, your lifestyle habits, but also what makes you feel alive now. And I feel like a lot of people are just in pain, so they have no purpose anymore, and their purpose can change. Maybe your purpose was to open a practice, have kids, you solved those goals, you've accomplished those things, what's next? So a lot of times people get stuck because they're like, I did all the things I was supposed to do, now what? Now it's time for you to connect with yourself and figure it out, like what really makes you feel alive. And for me, I'm very fortunate. I have love in my life, my kids are healthy, my practice is great, I have a really great team that supports me, so I'm always trying to give back to patients, but make them understand a lot of times they have to participate. And sometimes, same thing with pain. You have an acute disc herniation, you get an epidural, you feel better so that you can do physical therapy, right? It's the same thing with pain or depression. You get a little ketamine, you start to decrease the pain system within the body, you see things differently, you create a little space. It's just kind of a catalyst. Now let's do the work. And the work is a forever thing. And it's really a process that then you become accountable to yourself. And a lot of times people have to start to like themselves and really know who they are now and try to figure out where they want to go. So I think that it's a forever process when we look at medicine like this is a quick fix and there's no such thing. It's a journey.
It's a journey to continue, optimize, get better, get through all these barriers, 100%. And if you start looking at that as not as acutely, an acute fix, you're absolutely right. You'll have a nice journey. Well, wonderful having you as always and seeing you.